Welcome to Long Covid Doctor, an educational series for sufferers of long Covid. I'm Dr. Tim Robinson, formerly a family doctor, GP for 30 years, now GP lead for 3 NHS Long Covid clinics, and a GP clinical lead in Long Covid across the southwest of England. This episode is on swallowing problems and Long Covid. In part 1, I will talk about the symptoms, the diagnoses, investigations and causes. And in part 2, I will talk about the treatments, management and outcomes. Check out the references, resources and links to social media in the show notes below. Just to say, any advice, diagnoses, treatments that I mention should only be considered after discussion with your own GP or doctor or medically qualified health professional. So, here we go. Swallowing problems and Long Covid. Problems with swallowing is yet another symptom experienced by our patients with Long Covid. They are reporting less often than other symptoms. I suspect that many patients just put up with them. I think those other symptoms just overshadow and overwhelm the swallowing problems, which is a pity because there are certainly things that we can suggest to help with those problems, those swallowing problems. Patients report a whole range of symptoms. The list is long. The main ones are difficulties with clearing food from the mouth or throat due to soreness or irritation, feeling that the food goes down the wrong way, the feeling that food gets stuck in the throat behind the sternum, i.e. in the gullet or esophagus. And they have to take a really time and they have to really concentrate to eat. Something we're not really familiar with, aren't we? Because it's an automatic process, isn't it? They do say this. They say they've got to concentrate to get the food down into the stomach. There's a feeling that there's a lump in the throat. Or another symptom is that there's coughing and choking that's triggered by eating. Sometimes patients report regurgitation of food coming back up. They also report acid heartburn with swallowing or a rattly, gurgly voice immediately after eating, loss of or reduced sense of taste, interfering with eating, the need for throat clearing whilst eating and drinking. So as I said, the list is long. The patients with swallowing problems can present with any number of those symptoms. To understand the reasons behind all those symptoms, we firstly need to understand a little about the whole process of swallowing. We need to understand what normal swallowing is. So, swallowing, as we know, is that whole process of food and drink getting from the mouth to the stomach. This process is best understood by dividing it into 3 phases. So, the first phase, the oral phase, the mouth phase, from when the food and drink enters the mouth until it goes over the back of the tongue and into the throat, the pharynx. This obviously includes chewing, salivation, and the formation of a bolus, that is the lump of food, a food lump, that is channeled down and back into the throat. The second phase is the pharyngeal phase, from when the food bolus or drink passes from the throat, the pharynx, into the gullet, esophagus. During this phase, at the same time, the larynx has to be blocked off to prevent food from going down the airway and the breathing pipe, the trachea. And also the soft tissue shelf at the back of the nose, the soft palate, has to block off, to block off and prevent food going back and upwards into the back of the nose. All these processes happen automatically, involuntarily, i.e. out of our control. And then finally, the third phase is the esophageal phase, from when the food bolus and fluid passes into the esophagus and down into the stomach. Again, this is automatic, an involuntary process. Again, out of our control. So now we understand a little about the complexity of the normal swallow process. We are probably not too surprised to know that swallow problems in long COVID can come about for many numerous reasons. So, what are those reasons? Let's look at each part in turn. So first of all, back to the first phase, the oral phase, the mouth phase. Long COVID may have left us with inflammation of the mouth lining, interference with the salivary gland function, leading to a dry mouth. Long COVID may have left us with loss of taste. This is a common long COVID symptom indeed. And also the effects of MCAS, mast cell activation. So I cover both of these in much greater detail in my MCAS and taste smell presentations. So next, the pharyngeal phase. This is probably the phase that leads to most swallowing problems. Like the mouth, inflammation of the lining of the throat leads to irritation and soreness, which makes swallowing painful. MCAS is probably part of this. In the lining of the throat, there are tons of mast cells densely concentrated there, and when they're activated, this leads to swelling and mucus production, and this triggers the need for throat clearing. And also there's increased sensitivity, leading to a tickly cough, for example. Plus also it could lead to, that increased sensitivity could lead to a feeling of a lump in the throat, a condition known as globus pharyngeus. Other long COVID symptoms can also contribute to swallowing problems in the pharyngeal phase. Problems like heartburn, reflux esophagitis, acid coming up from the stomach causing irritation to the pharynx, and even overspill into the windpipe, the trachea, both resulting in cough, usually an irritating, tickly cough. Yet another cause of swallowing problems in this pharyngeal phase might be the effects on the autonomic nervous system, part of swallowing. The swallow centre in the brainstem may well have been affected by the damage to those areas by the COVID infection, due to inflammation, microthrombi formation, overactive brain immune tissues, the microglia, or even antibodies attacking the nerves themselves or the supportive connective tissues in those areas. And so finally, the esophageal phase. What can go wrong there in a COVID infection that brings about swallow problems? What can go wrong there? Well, many of the same causes as I've explained in the pharyngeal phase can also be at fault, particularly the MCAS, mast cell activation problems. Again, the esophageal wall has tons of mast cells in it. And also there are the acid problems from below, from the stomach, interfering with swallowing, making it painful and leading to acid rash, a tasty taste in the mouth after swallowing, but especially sort of a sharp knife-like pain behind the sternum, reflux, esophagitis, heartburn. As well as all these problems, another cause may be the interference with the vagus nerve. This nerve, the main nerve for the parasympathetic nervous system, the rest and digestive system, has so many functions around the body. One of the biggest would be in the gut. And the vagus nerve is the chief nerve that controls peristalsis, the contraction and relaxation of the esophagus, the gullet, that shifts food down the esophagus, and it also is responsible for opening the valve into the stomach. And we know that the vagus nerve can be affected by COVID, and hence long COVID. Studies have shown that it can become swollen due to inflammation, and this would interfere with its normal activity, and that is peristalsis. It would become uncoordinated. This is known as dysmotility, leading to, wait for it, you guessed it, swallowing problems. Yet another cause for swallowing problems in long COVID. And that's not all. Besides all those causes, yet another that may cause swallowing problems could be a condition known as breath swallowing pattern disturbance. It's a bit of a mouthful. Breath swallowing pattern disturbance. So that's with poor breath hold at the time of swallowing. When we swallow normally, for that instant that we're actually swallowing, there's a breath hold. So we're not breathing in at the same time as we're swallowing, so therefore not running the risk of food going down the windpipe, the trachea. So there can be a disturbance of that breath swallowing pattern that leads to swallowing problems. And finally, thought I'd never get to it, did you? Finally, for those unlucky patients who had severe acute COVID needing hospitalization, ventilation, so post-intubation damage can lead to laryngeal dysfunction, permitting overspill of food and drink into the upper airways, as well as speech problems. So there it is. As I said, the list is long. There are many, many causes for swallow problems in long COVID. It is complicated. And so now, let's get back to our patient. What do we do when a patient reports a problem? And in this case, swallowing problems. Well, as always, the first thing we must do is to know what we're dealing with. We have to make a diagnosis. We need to take a standard history and examination to get the diagnosis. Specifically, we are looking for possible differential diagnoses, i.e. other diagnoses, poor English, another diagnosis in which swallowing problems are also present. How do we go about this? As I said, we need to take a thorough history and examination. So first of all, the history. We need to know everything about the swallow problem. What exactly the patient is experiencing. How often and for how long. Any worsening or relieving factors. And the impact it is having on their everyday life. Whether there are any associated symptoms, such as cough or indigestion, heartburn, weight loss, regurgitation, food getting stuck, plus associated long COVID symptoms, particularly those that would make us suspect MCAS, mast cell activation, or dysautonomia, and hence difficulties, problems with the autonomic nervous system. Plus, what about the past medical history? We want to know whether the patient has had indigestion in the past or chest problems in the past. As well as that, medication that they may be taking, and also any supplements, etc., that they may have experimented with themselves, or not necessarily supplements, but medication that they may have bought over the counter in the pharmacy. That's history done. Now it's on to examination. And this will be a general examination according to what was uncovered by the history. Having taken the history and examination, it's on to investigations. Well, in primary care, the GP will have investigated the patient with long COVID with those standard blood tests as recommended by the NICE guidelines on long COVID. So that's the full blood count, the kidney function, liver function, the inflammatory markers, that's CRP and ferritin, the thyroid function tests, and the HbA1c, looking for diabetes. So a couple of those aren't directly relevant to our swallowing problems, but that is the sort of the standard bank of blood tests that are expected in a patient with long COVID. If the GP feels it is warranted, the next investigation would be endoscopy. That is the upper GI tract endoscopy, upper gastrointestinal tract endoscopy. So this is a flexible scope camera slid down the back of the throat to see directly into the esophagus and the stomach. It's a quick and painless procedure to look for ulceration and narrowing of the gullet and scarring, but most importantly to look for any growths, cancers of the esophagus, the food pipe. And the reason why we have to be so thorough is to look for red flags, i.e. signs and symptoms that suggest something more sinister. And so, what are the red flags in patients with swallowing problems? The ones are the main ones, let's say. The main ones are food getting blocked during swallowing, i.e. blocked halfway down, or regurgitation of food, i.e. the food gets blocked and then it returns. Also weight loss for no obvious reason. Patients may also tell you that they have taken to eating soft food only, or blending their meals, or needing a drink to wash their food down when they're swallowing, when they're having their meal. So any of these symptoms would make me very concerned that there might be a cancer in the esophagus. Even if there are no clear red flags, but your instinct tells you that something just isn't right, just ask. If in doubt, ask. Go to your doctor, go to your GP. This is important. We don't want to miss something. The other reason why we've been so thorough with our history investigations and looking for red flags is to be sure that we are not being COVID blind. So what do I mean by this? So just because you've had COVID, it doesn't mean that a new problem, in this case swallowing difficulties, can be put down to that COVID infection. It might be due to another cause, totally unrelated to COVID, but that acute COVID infection just happens to have occurred at the same time. So, as I said, we mustn't be COVID blind. And so, having completed the thorough history and examination and investigations, having excluded red flags, we are left with the problem of swallowing difficulties that have arisen as part of the long COVID picture. So that's what's happening. Hopefully, we now understand the causes behind those swallowing problems, and we are confident that they are due to long COVID and nothing else. But what's more important is, what are we going to do about it? And I'll come on to that, the management of long COVID swallowing difficulties, in part 2. And so that concludes the first part of my talk on swallow problems with long COVID, the symptoms, diagnoses, and investigations, and the causes, lots of causes. In the second part, I will talk about the treatments, management, and finally the outcomes. So I hope you found that helpful. Check out the references and resources and links to social media in the show notes below. And as I said at the start, any advice, diagnoses, treatments that I mention should only be considered after discussion with your own doctor or medically qualified health professional. So in the meantime, I wish you well. I wish you well with your long COVID recovery, and hopefully we'll meet in the second part.